Welcome to Konfidence with Katheleen, hosted by me, Kathleen Diggle. Hey, welcome everyone. Today I'm with Dr. Espey. Dr. Clay, thank you to accept to do that podcast with me.
Thanks for having me.
So thank you so much, And can you talk a little bit more before we start? Present yourself and what is your background and where you come from.
So my name is Dr. Clay Espey. Born and raised in Louisiana, St. Gabriel, Louisiana. We grew up with cattle and horses, come from a rodeo family. We also showed Brahman cattle for several years, probably up until I was in college, in vet school. We've done that for forever, and I guess Dustin and I have been together for maybe 10, 11 years at this point. And so our program now, what we do is I'm a veterinarian, and we he trains futurity horses and barrel horses, and that's kind of what we do these days. It's horses.
Horses
Yeah.
work, and then when you come home, it's work again.
I tell people I work harder at home than I do at the office all day. I have my list waiting on me when I get home. So
you have a list here. I know all the time.
Yep.
But it works because Dustin have succeeded. It's a success too with all his horses, but it's a team work.
And it's a harder client to work for because I get told how I'm lacking or slacking because I haven't gotten this one injected in time or that one injected in time.
I know.
Like what they always say, your personal stuff gets left to last.
To last very often. Sometimes, I hear that too. So, I know you work more, a lot with the horses that they are athlete and whatever. What do you suggest for those horses to take care of them? What do you feel that can really help a horse the most,
So I think it's just regular maintenance and creating a plan on each particular horse. I think a lot of times people don't make plans or talk to their vets enough in order to, these are performance horses. So we have to keep them feeling good. We have to keep them looking good, wanting them to feel their best in order for them to compete and we can get the most out of them for whatever particular discipline or whatever that we're doing with this horse. Sometimes I think it's important to have these horses examined every 6 months or so, depending on, some of these horses that we're looking at sometimes have particular problems that we need to look at more often, but it's just following up on these guys, making sure that they're feeling their best. They're doing what we need them to do in order for them, to get the most benefit out of them.
Yeah, and instead of waiting to see the lameness, and because when you see it very often, there's more than one lameness. There are other problems.
Absolutely,
too.
And that's part of, why people say we practice medicine. A lot of times when we see these guys, it's not the actual cause of lameness that we're seeing initially. It's a lot of the compensation, their, particular, whatever that they're doing. It's because something else is hurting them, so they're going to move a different way. And that's what we're going to see. And once we get that particular problem treated, then we may actually find what's causing the majority, the initial cause of what's started all of our problems. And sometimes I think people wait too long, and by that point it takes a lot more to get these horses sound or feeling better, and you have to create a multiple step process in order to get, and it's not an instant fix. It's done over weeks to months, depending on what's causing it. The other thing is, I think sometimes people are too quick to change things. I will say one of my biggest things is just from a vet perspective and owner perspective is I think there's so much out there. You can read the internet, you can read, there's forums, Facebook forums, or people giving advice, and I think some of that advice is really good. But I think you also have to look at who's giving the advice sometimes, and not just go with whoever is telling you to do. And I think sometimes people, it doesn't matter to me. I'll tell people all the time, it doesn't matter whether you use me, you use whoever, or whatever. But I think you need to stick with someone or something for a particular time in order to see a change and see if you have any benefit. Because what I may suggest may be something different than what you suggest. We're both getting to the same goal, and we may both get there. But if we change things up too quickly or too fast, well, that horse is never going to get there, depending on, whatever we're trying to do. And different types of, things that are out there, no matter what you're doing, I think you need to give everything time and allow the process to work.
Okay. So for the injection too, there's so many different products, different things. Yep. What do you have one that you prefer, or it depends on each horse?
It depends on on each horse. It depends on whether we're doing regular maintenance, whether, it may be something easy that just we haven't maintenance in a long time. We just need to do a steroid and an HA product, something like that, just because the horse is a little sore just from performance. If there's an actual injury that we're trying to treat, or cause some to heal. So there's so many different things out there. It becomes a case-by-case basis on what that horse needs, and what's going on with the horse, particular lameness with that horse.
So, and is it, because I have that question sometime,
Yep.
So is it true that if you inject one time, that means you will have to inject all the time or every 6 months or whatever?
No, because sometimes what we're seeing is we may have one joint is sore because it's compensating from another problem. So once we fix the actual problem, we may never have to maintenance the area that was compensated, or like we may have to change some shoeing on a horse or something like that. Our angles may be low, or different things like that. And once we fix the actual problem, then we don't have to maintenance that particular area again. Now, in some cases, like I said, if we are maintaining a known problem, or we've diagnosed something, yes, then we may be injecting every 3, 4, 5, 6 months, a year, depending on what it is, and having to change what we're injecting with each time that we inject in order to make sure that we're getting the most benefit. To make that joint quiet down, or that injury quiet down, so we can go on and keep competing on that horse.
Okay. So we talk about the injection, the joint, but what else do you, like if I bring my horse to you, you do the lameness exam.
Correct.
But what else? Very often you see that the horse, people, I'm not saying they don't take care, but they need to take care. You suggest more, you can see on the horse.
So, you have different things that they benefit from, chiropractic work. Different things. One of our things that we use a lot in our program is we use the MagnaWave and the Shockwave quite a bit. It's different things that helps keeping these horses feeling good. But, I think sometimes where you get yourself in a bind is people may wait till they get to a show and think, okay, well, let's hurry and get this horse MagnaWave or shot or whatever it is that you want to do. Well, one time's not going to do anything for you. It may make them feel good for that day, but you're not going to get any long-term benefit from this. You got to think, even when it comes from a human perspective or a human athlete, if you have rehab stuff or things, you go weekly to, or doing things weekly or a couple times a week in order to help feel better. That's where you get your most benefit from. A one-time fix is not gonna, it doesn't exist.
Okay.
They'll feel good for a while, but different things like that. We ice a lot of legs. When we're at the shows, we do the saltwater spa quite a bit. But also at home, we're also taking care of those things as well. So those horses are used to things like that. These are athletes. We have to do what we can in order to make them feel their best. When they feel their best, they're going to compete to the best of their ability. And that's just kind of part of any kind of athlete that you deal with.
Mm-hmm. Waco want to say hi, yeah. Okay, so and I agree with you too, because I feel like right now I'm, Alex do some massage too.
Correct.
And I'm feeling those horses that receive a regular massage. It really, even before or after the Caro, that helps the Caro, that helps the vet, that all together. But on regular basics,
well,
change.
it's consistency. You want to try to do everything on a consistent, regular basis. Just if you go to the gym one day at the gym, it's just going to make you sore. It's not going to give you a lot of benefit. But it's the same thing with the horses. I think everyone has to create a program that works for them, and it's not saying you have to have the best of the best of the best.
No.
In terms of the different modalities that are out there. I think it's finding what works best for you.
For you and your horse.
And your horse within your means, but it's doing it on a consistent basis to where they feel good, and you get some results. Now, if you're not getting results, well, then it's time to change it up. Find something else that will make them feel
works
good.
Good. But again, I'm come back. I arrive at your place with my horse, but I'm feeling stomach.
Yeah.
Do you see that a lot on those compete horse,
Correct. You got to think we're putting them in very high stress situations. So I think a lot of these horses do have a lot of stomach pain, whether it be their stomach or hindgut issues, those type of things. So a lot of these guys, we recommend you keep them on different medications when you're hauling and competing. And then again, it depends on whether we're treating something or if we're trying to do preventative measures. Whenever we're treating horses with ulcers, for stomach, we use a lot of any kind of omeprazole products. You have GastroGuard, UlcerGuard. They have a lot of people that have compounded omeprazole products that work really well, depending on the pharmacies that you use. And then whenever it comes to hindgut ulcers, we use Succeed. That tends to help quite a bit. Those are the products that I think actually help treat ulcers. There's other products out there that people use. These different companies make gastric aid products, and that's basically what they are. They aid to try to help prevent any kind of ulcers, but they're not going to treat ulcers. They're going to help maintain the stomach pH or try to keep the acid production down, those kind of things. But they're not something that you would do to try to heal the ulcers. It's going to try to keep them from coming back after you've treated them, or to keep them from getting the ulcers if you're up and down the road, or these horses are in high stress situations.
So when you go on the road, like with Dustin, with all those horses, do you always put them on like omeprazole and
Yes,
Succeed?
so we always start a couple days before we leave, and they stay on it the entire time that they're on the road.
On the road.
And when you're doing, especially like if you're using omeprazole or those type of things as a preventative dose, you can treat them at a much lower dose than what you would do is if you were trying to actually treat the ulcers. We're just trying to prevent it, so we keep them on a much smaller amount just to try to help keep the stomach happy, while we're on the road till we get home, those kind of things.
And do you have right now like a product supplement for the stomach too, or
so
you don't?
We don't. Nope, we don't have anything that's a daily supplement type thing. We treat them as we need to, and then keep when we're on the road, we keep them on.
Okay,
Yep.
Because I'm feeling, there's so many products, there's so many things. And even me, sometimes, and I know those products are all good, but sometimes I'm feeling from the point of view of the horse that sometimes it's too much. I'm feeling sometimes because, but some people say, it works good on her horse, so I want to try it, but then they had it to another, and sometimes it's too much for the horse. Do you feel that?
I do, because I don't think every product's going to work the same on every horse. So, I think, the magic question is everybody comes in, well, if it was your horse, what would you do? Well, I can't tell you that, because what one of my horses may work well on one of them is not going to always work well on a different one. So you have to, there's so many products out there. It's just sometimes it's truly just trying them to see, okay, this works well. Whether some of them are feed through, some of them are injectables, some of them are oral. It's just, it doesn't, and some horses don't like them. Just simply don't like a particular product for
No reason.
for an unknown reason, and you have to just kind of change it to make sure, see what works best for them and for you.
So, and again, that's what I'm feeling with the horse, but I'm feeling sometimes people, they start to give them something for their stomach or whatever, but after 1 week, they don't see no change, so they stop or they add something else.
Yep.
And for me, what I'm feeling on the horse, it's usually takes almost 3 weeks before the horse knows or feels the difference.
Yeah.
If that makes sense.
Yeah, I do agree with some things. It's some things that it takes a while for them to really know what's going on in their body changing and what's, if it's working or not. I remember there's times that we've had you talk to some horses or something like that, and they're like, well, you started this 3-4 weeks ago, and I'm like, I don't even know what we did at this point. You know what I mean? But it's like you have to think back, okay, well, it's taken that long for them to really know
That
Yep.
that if
And a lot of times, depending on what we're putting them on or treating them with, I tell everybody, give it 30 days.
Yeah.
30
at
days,
least.
at least 30 days. If you see zero change after 30 days, well, then maybe we need to change something. But if you see some change, well, then we need to keep going, because it may take a little bit longer for it to achieve what we're trying to get it to achieve.
But at least 30 days.
Yes, at least 30 days. Yeah.
Perfect. And what about the respect when they breathe and things like that? So what about it?
So, I think that's another important issue that we have to deal with in terms of helping these horses, get them feeling good and being able to compete at the levels that we want them to compete with. If you can't breathe, you can't, it's hard for these horses to really do what they need to do, and that comes with, whether it's an issue of them just needing to be fitter in order for them to be able to breathe and have the air intake and that they need in order to compete, whether we are treating a problem, if it's a bleeding type situation, if it's an allergy situation that needs to be tended to, is the reasons why they can't breathe and compete. And I think sometimes it's just a matter of trying to figure out exactly what's our underlying problem in these guys. And I think sometimes it takes a little time to figure it out and go forward from that point. I think, people are quick to jump on I think there's a ton of horses in our industry that are bleeders. They're having to exert themselves and very quickly in a short amount of time. But is it because there's a true problem, or is it because something else is causing the problem? I think a lot of these guys, we've had horses, and I've seen horses that aren't, I wouldn't call them true bleeders, but they were in a situation where maybe they had a little underlying infection that was causing the bleeding. Maybe it was a situation where the horse was under severe allergies or suffering from allergies, and that's what caused the bleeding. A little pneumonia or something like that. And then once we treat those things, the bleeding stops. And then sometimes there's true, so I don't necessarily always call those guys true bleeders, because there was something causing the problem. The increase in negative pressure within those lungs causing the capillaries to burst, and that's why we were bleeding. But then there are some that they're true bleeders, and it doesn't matter what you do, they bleed.
They bleed.
Yep.
So, and I don't know if you believe in that or whatever, but I'm feeling sometimes the horse, like you said, there's different reason why they bleed, but like about the allergy.
Yep.
So, do you feel that, but that's my point of view too. So I'm feeling sometimes when you have an allergy test can help you to really find the reason and things like that.
Yeah, absolutely. I mean, I think a horse, sometimes that what we recommend is doing allergy testing on these guys if we think it's allergy related. I mean, we're down in South Louisiana. It's that the molds and the allergens, it's out of this world. So sometimes that's what's causing our horses to bleed, the humidity, the moisture in the air, those type of things. You know, you can start with simply just doing an allergy test. So sometimes things are very, very simple in terms of just doing a blood test to see if there's something we can eliminate out of these horses' environment. Whether it's sometimes it's a particular type of grass, or it's a particular type of product in the feed. Sometimes it's certain insects, certain molds or mites or those kind of things, that if we can kind of treat those things and eliminate those things, it helps the horse quite a bit.
Okay. Yeah, you were saying about
I mean, we had one horse that kept having some problems just from not a bleeding standpoint but allergy standpoint. It was a client horse that was literally allergic to cats, and the cat was sleeping on the horse's saddle blanket, and that's what was causing all our problems. So that's an easy fix, you know, stuff like that. It helps eliminate things, and that it exists in the equine world just like the human world. You can do shots to help desensitize the horses and stuff like that. Sometimes it doesn't work, sometimes it does work. It just kind of depends on the horse. But a simple thing is just knowing, okay, well, if I can avoid these things based on this allergy test, well, maybe we can improve the health and of our horse and make them feel better.
And sometimes, yes, the allergy affect their lung, but can affect their stomach too. I'm feeling, you know, if they have those allergy too, that sometimes if they allergic to something, they create problem too.
Well, different grasses or feed, I mean, it causes an inflammatory response, which can, you know, depending on part of the body, will affect different things.
So, and what is your thought about all those supplements? You know, we talk about it a little bit, but what is your thought about it, and how do you use them first? What do you do?
So I think you know, when it comes to a feeding program and your supplements and all that, it's a horse by horse basis or a program by program basis, but I think it's truly a matter of being consistent within what you're doing. Sometimes I think, you know, I think people think, you know, if a little bit's good, more is better. And I think sometimes we get you know, people can get themselves in a situation where we're giving so many supplements that we're truly overdoing it. Now, if we're giving supplements in order to help maintain a particular problem or a health issue that we know of, you know, there's certain things out there that, yes, you need to continue doing those things and treat it accordingly. But sometimes I'll see some people, we may be given 10 different supplements. Well, you know, we're giving one supplement for this, but that's causing this, so then we're giving another one to counteract that, those kind of things. And I think sometimes it's just too much for them. And I think sometimes that can create problems within itself because we're just, the body's almost detoxing sometimes because, you know, horses are like humans. If they don't need whatever we're giving them, well, then they're going to filter it out. Well, if we're overdoing it, then it can create some health issues as well. So sometimes we tend to do less is more. You know, I think when it comes to feeding programs, there's a reason why these different companies, whether it be, you know, your two biggest ones are Purina, Nutrina, those type of companies, you know, and you have your other different companies, they spend billions and billions of dollars on creating these balanced feeds or, you know, complete feeds, whatever it may be. So in our particular program, you know, we're also dealing with younger horses, so we don't have a lot of aged horses that may have arthritis issues or, you know, joint issues, those type of things, or, you know, getting into, you know, endocrine issues or anything like that. So we don't feed a lot of supplements because we have younger horses, but at the same time, those feeds are so balanced, there's no need to have to add a ton of other things to it. That's why we choose the feed programs that we do. We're big Nutrina. You know, we've been on Nutrina products since 2016, and they've been good to us. We haven't had any problems. We've been able to maintain our horses and do phenomenal things with them, and we've been with them for almost 8 years now. You know, so it's not saying that's what you have to do. Everybody, depending on what you have with your horse, you just need to research and look at what you're doing. You know,
Mm-hmm.
if you're having to feed 15 different things, you're not doing something correct. You know,
Yeah.
you're doing too much. Like, research what you're doing, and you know, find stuff that's balanced, that's going to fit what you're wanting to achieve, and that's going to benefit your horse.
Yeah.
I don't believe in having to give,
Fifth.
you know, a ton of different supplements to these horses,
Perfect.
unless you're trying to treat a particular, you know, trying to aid in treating something that you know is truly causing them a problem.
You can add it, but
Yep.
when it's done, it's done.
Yep.
You know.
And another thing is, you have to do, you know, a lot of these people do pull blood or hair samples or something like that and get it analyzed to see what what's going on. And what's important to remember is that is a snapshot in time. At that particular moment, when you have that particular blood or hair analyzed, that is what that horse is deficient in or too excessive in at that particular moment. Well, yes, then you may need to adjust what you're doing for a little bit. But once the horse, you know, equalizes and becomes sufficient and everything, you don't continue that, because then you create, you know, so you know, you may only have to do it for 30, 60 days and then stop.
Stop,
you know?
and
Because at that point you've corrected your deficiencies or those kind of things.
Yeah. Another things too about, because we talk about supplement, but I will come to that vitamin too. But before we talk about vitamin, can we talk about EPM?
Okay.
I know that EPM, it's a big issue. It's a big things around here,
Yep.
around, you know, even Texas, everywhere.
Yep.
There's, and more, it starts to be up north a little bit
Yep.
more too. So what about EPM?
So it's a major contributing factor to, you know, some of these horses, especially from where we're from in the South, you know, United States, with the possums and everything else. It affects these young guys. Well, all of them, young and old, quite a bit. You know, it's a real thing. It's, you know, these horses that we're dealing with are under a lot of stress. You know, the training programs, what we're asking of them.
Yeah.
You know, that their body takes a lot of stress off that, and that allows the EPM, and especially where we're at in Louisiana, most all horses are exposed to it. You know, they're exposed to the EPM. It's whenever these guys go under extreme stress, you'll see a lot of times when they get sent off from the colt breakers, or, you know, these 3-year-olds that we're having to really, you know, do a lot to try to have them ready if we're going to futurity them for 4-year, or even, you know, 4s coming 5s. That's when you really see it kind of take a hold of these guys, just because their bodies, the amount of stress that it's in. You know, and it's something that you have to treat in order for them to feel better and be able to compete at the levels that we're asking them to compete at. You know, and sometimes it becomes it goes undiagnosed for a little while, because it's subtle. It's something that we walk out one day and we're like, oh, my horse has EPM. It's a gradual process that happens over days to weeks to months.
Sorry, but if someone arrives, how do you try to see if it's EPM or what?
So there's you have to truly ask the clients what's going on with the horse. You know, a lot of times, sometimes these guys come in there that are suffering for EPM, and we miss it as well as a vet miss it, because these guys, sometimes they present as just minor lameness things. They may show up and these horses are a little off here, a little off there, sore here. They're maybe muscle sore, you know, have a little bit of muscle atrophy, those kind of things. And we take it as, okay, well, we've got a lameness going on. And truly, sometimes it's not even a lameness, just these guys, they're not aware of their surroundings. They're not aware of their foot placement. They have, you know, their muscles are weak. They can't carry themselves the way we want to. And it's an EPM thing rather than a lameness thing. And a lot of times what I'll see is these owners, they just want to, you know, treat and, you know, chalk it up as a lameness, and we get ourselves in trouble sometimes, because if it's EPM, and we start doing a whole lot of injections and nothing's getting better. Well, it suppresses, the steroids suppress our immune system and it allows the EPM to really take control of these guys. Yep.
Yeah.
So a lot of things what we do in our, like when I'm evaluating a horse, we'll just kind of talk to the owners and try to get them to, there's certain things that I listen for whenever they're explaining what's going on to try to, that might trigger, this might be an EPM thing rather than a lameness thing. There are certain things that we can do on the lameness exam or neuro exams to kind of see how much they can control what they're doing and whether, and that'll kind of help lean one way or the other. Okay, well, I think maybe this is more of an EPM thing rather than a lameness thing. Let's treat him for 30 days, reevaluate him, and see if we have a different horse in 30 days and whether we need to continue with an EPM or maybe it is more of a lameness type thing.
Yeah.
So.
Okay. But because for me, when sometime we work together and sometime you said, Kathleen, do you think, and for me, when a horse is EPM, I'm always feeling more the right side of their body.
Yep.
It's always something, because that's the reaction, that's how, but does that make sense for you? It's like if the EPM affect more the left side of their brain.
Yeah. Yeah, for what reason? I'm
you
not
don't
a
know
neurologist
why,
to know
I know,
that.
But
yeah,
for me, each time, anyway, that's what I'm feeling. Okay. And another things too, so what do you suggest to treat with EPM, for EPM?
So there's a ton of different products out there.
Yeah.
We have, compounded products that's like a diclazaril, Tazaril, there's Protozil, there's Marquis. There's so many different things out there that you can use to treat these guys. And I also think it depends on how advanced these guys are, depending on what you may or may not treat them with. I think some things tend, when we're doing preventative things or we catch them early on, they tend to work a little bit better. And then when we have severe cases, other products tend to work better. And so it just kind of depends on the horse and what stage we feel they're at and how we need to proceed with them.
And do you feel too that in the same time that you give the EPM do you do that, or you suggest the EPM to treat the stomach in the same time?
Yeah, because I do think it does create some stomach issues as well. Where a lot of these guys is mixed with DMSO or different things like that. So I do think it does upset their stomach.
So not to make sure that after the treatment they are good, you didn't create other
didn't
problems.
create another problem. So a lot of times we'll do it in conjunction with each other.
Do you is there a way to prevent the EPM to flare back, or not really yet?
I don't think so. I take that back. I think if you keep these guys on some vitamin E, I do think it helps try to prevent things. Then it, sometimes it's trying to figure out, not that you can eliminate it, but sometimes you have possums around your house, so you get rid of those kind of things. Sometimes it's, we get hay or stuff like that come in, and it's coming from that farm, or those kind of things. So I think keeping them on vitamin E, those type of things, does help try to prevent it, but it doesn't always completely.
Talking about vitamin E, because there's a supplement that I'm feeling because of that.
Yep.
Because of the EPM, people give a lot, but can they give too much? I'm feeling there's a dose, but when you give a supplement of vitamin E, but you already have a vitamin E in your brain, and then a vitamin E in this supplement.
And vitamin E, especially when you're giving the medications, a lot of these compounded things have the vitamin E in it because it helps with the absorption of things throughout the body, and depending on where it's being absorbed at. So sometimes I think you can overdo it to some degree, and then the problem is with what we were talking about, other supplements, if you're overdoing it, well, then you're just wasting your money as well, because your body's going to get rid of it. So I think it's all within labeled doses, depending on what you're using as to how much
to look.
Yeah.
But what is on a horse? Is there a limit of vitamin E that you do?
There, I mean, all those things like that.
It was
There is. I
1,000?
don't remember. I would have to go
1,000?
back and look exactly
Okay,
to
exactly.
what exactly what it is. But yeah, there is. You don't want to exceed certain limits before you can create other
problem.
And that's not just with vitamin E. That's with anything. You know, you can get it to a toxic level at some point. You know,
if you gave too much, like even the B12 or all those kind of vitamins.
Some of them, yeah.
Some of them, not all of them. Not all of them, but some of them.
Yep.
The best way to know is to talk with your vet.
Absolutely.
That's what I'm feeling. You know, we talk about EPM and the vitamin E and different supplements and things like that. But for your client, what do you advise them? You know, what do you suggest, or what is your best advice that you can you always say to your client?
Yeah.
Probably.
So I think you know, depending on, I think you have to come up with a plan with each client. I think you truly have to, you know, establish a relationship with your client and that patient in terms of what are their goals, what are they wanting to achieve, and helping make a plan for them to achieve those goals. Whether it be, you know, these performance horses, I think you need to look at these horses regularly, because one of the biggest things is sometimes these clients don't come in enough and they wait till there's a problem. And then when we see those problems, things are too late. So whether it be, you know, we do a lameness exam or physical exam every 6 months to a year, depending on what, you know, if we're showing, not showing, competing, not competing, those kind of things. So we can address what's going on before things become problems. You know, I'm a big, firm believer in, you know, I tell a lot of people, you know, trust in your vet. And I think you need to, you know, when I tell people all the time, I don't care whether you use me, who you use, or whatever, but I think you need to find someone that you trust and that you like and that you have confidence in, and you need to create plans and stick with them. Because I see it all too often that too many people, they jump from person to person to person. Well, the things that I may tell you to do for what you're wanting to achieve may be different than what you're wanting, you know, you may tell someone to do. Although we're getting to the same goal and the same thing, it doesn't always allow that horse to heal or to ever get to that particular spot, because everybody's constantly changing too many things. My view is different than someone else's view, and neither one is wrong, but there's too much change going on in this horse, and it's not allowing that horse to get to where we need to do. You know, I think it's consistency. You have to create a consistent program, a consistent schedule for these guys. You know, kind of going back to what we talked about earlier, there's different things out there with the magna waves, the shock waves, the hydrotherapies, the different things, supplements or whatever. You have to do these things consistently. You know, one time of any particular thing is not going to make a difference on these guys. It's creating a program within yourself that you're comfortable with, something that you can do. Not saying you have to have the best of anything or, you know, the top-notch new gadget out there. It's whatever works for you and that horse, and doing things on a consistent basis to where you see benefit and it helps keep these horses going. You know, the way that the equine industry has advanced over the years, you know, what we're doing now, we weren't doing 10 years ago.
No, the technology.
The technology is unbelievable. But at the same time, you have to be careful, because it can get yourself in trouble as well. Because there's a lot of things that I see it every day on, you know, just for instance, like pre-purchases or something like that. We have no crystal ball. There's no crystal ball as to what you know, how these horses are going to perform in 2 days, 2 months, 2 years. And what happens is, you know, a lot of these guys come in for these pre-purchases and stuff like that. And because our technology is so advanced, we can find so many things that these horses have that you wouldn't have seen 10, 15, 20 years ago. You know, and one advice I tell people, so again, it can get us in trouble sometimes, because we may find problems that aren't even giving those horses any
A
problems.
problem, yeah.
And personally as a vet, I've gotten myself in situations to where we try to fix problems based on what we find that's not even a problem yet, and then we create a problem. And I tell people, and this is one of the biggest misconceptions people come in with, and because of our technology, does a source pass or fail?
Mm-hmm.
There is no pass or fail.
Yeah.
I tell them straight up, there is no pass or fail. When you come do a pre-purchase exam, what we're doing that day is we're evaluating this horse, telling you what we see. It's all subjective. What I may see may be something different than what someone else thinks is the problem. And this is what we have. Mm-hmm. So, what I tell people, okay, so if we found a problem, okay, well, now it's your decision as the purchaser. Are you willing to maintain, or can you maintain and are willing to maintain what we found? Some of these guys come in and there may be, an example, it may be an old horse that we find a ton of different issues with. Well, you know what? This is for our 3-year-old little girl. He takes care of our 3-year-old little girl. Like, we can, well, then that's a win-win for you.
Yeah.
Not saying that particular horse is going to work for someone that's wanting to go compete at the highest level in whatever discipline they're competing in. But, it's all, we have to remember, we have to keep things in perspective. Keep in perspective of the big picture. Just because it doesn't work for you doesn't mean it doesn't work for them. And you also have to keep in perspective as to what's going on. And I mean, there's a surgery to fix almost anything, and there's no, will they come back from that surgery? We don't know. But there's so much, so many advances in medicine and treatment options and stuff like that that a lot of times we can't. You can get them back to where they were. So it's just, I try to tell people, keep it in perspective. Just try to you got to make a plan. You have to, in several different options, this is what we can or can't do.
Like for me, a lot of people, when I'm doing my communication, they like, okay, we will fix everything, and can we make a call back to do a follow-up?
Yeah.
And very often, I'm not saying that I cannot do it, but it's because if you fix something on the horse, before he knows that he feels better, he needs to get through it and forget his muscle memory and get through it a couple times. So if the horse doesn't know that he feels better, from my point of view, I won't know it, if that makes sense. Or what I'm feeling too, it's like, in 2 weeks, there's so much thing that can happen that it's different. Probably that, like for you, when you did the Porsche's test like that, you exam on the horse and they let them outside, there can be something that happen over there. They are horses.
Absolutely.
Yeah, and it can, even if you inject a hawk, it can be like 1 week after another place because, does that make sense?
Absolutely, they do. They do something different. It's a different injury. So.
Yeah. Yeah. Perfect. One last question before we finish. Sure. So, how do you deal going to work every day? Being on the road, like with coming here. How many horses do you have here?
You will say close to 40.
Too many.
Yeah,
too many.
Yeah.
And the kids now, and the dogs, and go on the road. It's a lot.
It is a lot. It's truly, it sounds so cliche to say it, but you have to find your own balance.
Yeah.
I pick all the time saying that I work harder at home than I do at the office every day, but I mean, you got to think it's finding a balance between home life, work life. We have, with the kiddos now, with Jordan and Dakota, it's their life. It's finding what works. And, it's truly, in this fertility world and things like that, there's deadlines. Everything's deadline. And in life, in general.
Life, too.
In life, in general, there's deadlines. And you have these goals that you have in mind, and this is what we need to do by this particular time. I used to think growing up, by 20, I needed to achieve this. By 30, I needed to achieve this. By 40, this is what we had to do. You know what? And as you get older, some of those things don't matter anymore.
Yeah.
It's like you used to thought you had to have this and that, and now it's like, I don't want any of that. Like, it's not important. And I think it's finding that balance as to, okay, we get up in the morning, we got the kids to take care of, they got to go to school, I got to get to work, I got to attend to clients, come home, we have all these horses to attend to, families, and life happens. Different things happen. You never know when something's going to come up that you just have to deal with it. And I think it's truly just a matter of what works for everyone. And it's different for everyone, and it's just achieving what you want in life and what makes you happy, and not overextend yourself in one particular spot. That's because you got to think, when one thing takes more of your time, well, then it's got to take it from somewhere else, and it just depends. And I guess over the events of the last few weeks to months in our life, there's been a bunch of things that have changed, and certain family losses and things like that, and it really puts things into perspective. Okay, like,
is it all worth it,
or like, is this truly that important, or do we need to take care of it? So it's a matter of, it's truly trying to find a balance, and a balance that works for you, and a balance that keeps you happy, and tend to the things that are most important to you in your life. It's tough, but it's something everybody's got to deal with.
Yeah, but
everybody's life is different.
You're doing it.
We're trying.
I know you're trying, and I know you're doing it.
It's just sometimes, it's finding that balance, and it's some days you just think to yourself, oh, there's no way we can't do it, and that's. I guess over the summer, these past few weeks, I think we had Jordan's kindergarten graduation, and it's. I think Dustin was at Fort Smith, maybe, or somewhere. I don't remember. And it's literally we pull up to kindergarten graduation. It is. It's the whole year. I forgot the cap and the gown, so I'm like 15 minutes to spare. I'm like, so I called Dustin. I'm like, I'm almost crying. I'm like, I can't believe I forgot. That's what we're here for,
Yeah.
And he's like, it's fine. I'm like, no, it's not. That's the whole point, And then I'm trying to rush home. Thankfully, we don't live too far from their school. Trying to get back, and then trying to they're walking down the aisle, trying to throw. It's just chaotic. Everybody's chaos is a little different, I guess, depending on the day, But in the end, you get it done. You do what you have to do. It's you don't think about it. You just do what you have to do to make it work.
And
so
you really do it well. And I'm very grateful to be your friends too. And you had me like for 2 weeks now that I was here.
We're grateful to have you.
It's been a while. It's been almost 3 years. I think we didn't see each other. We talk a lot on the phone, but and talking by the phone. If someone want to reach to you, so where they can find you?
So I'm located in Prairieville. You can always call the clinic, Kleinpeter Equine, 225-744-4671, if for any kind of, your horse needs or anything like that. We can
help you for sure.
Try to do our best.
You always, and you are very good. Thank you, Clay. I really appreciate it.
Thank you for having me.
Thank you for sharing your time with me. Please make sure to follow, like, share, subscribe on all my social media, and don't forget to leave me a review. If you want to learn more about me, visit my website, horseconfidence.com with a K, where you can also order my book.